In geropsychiatric nursing, you call upon your generous stores of knowledge and compassion every day, especially when you're caring for an older person with delirium. Your geriatric assessment skill set is critical to the well-being and safety of your patients and can make a difference in the early diagnosis and plan of care for older persons with delirium. Delirium is a common, costly, and dangerous syndrome associated with substantial morbidity and mortality for the aging population. The prevalence rates of delirium are very high across settings, including 1/3 of older persons in the emergency department, 1/2 of medical surgical admissions, 80% of mechanically ventilated patients, and 60% of nursing home residents. The cost of delirium is as high as $152 billion annually. We used to think that delirium affected older persons only while in the hospital, and maybe a short time after being discharged home. We now know the longer delirium persists, the outcomes are more severe. Delirium is an independent risk factor for dementia. Delirium is a syndrome and neurocognitive disorder that must be diagnosed promptly. However, the atypical presentations in older persons often mask the underlying causes. Delirium often has multiple etiologies, including medications, infections, neurological causes such as stroke or seizures, cardiac arrhythmias, MI or CHF, pulmonary causes such as COPD or respiratory failure, metabolic disturbances associated with hypo and hyperglycemia, and alcohol or substance misuse. The best treatment for delirium is prevention. For example, studies show that hospitalized older persons who are out of bed as soon as possible after surgery experience better outcomes. Early mobility is an example of a preventative strategy that should be included in the treatment plan. By understanding the causes of delirium and recognizing the signs in a patient, you can correct a negative outcome. Early diagnosis and effective preventative strategies represent the highest standard of care. To learn more about delirium in older persons, click on the following link to the continuing education module, Delirium, Reducing Iatrogenic Brain Injury in Older Adults, for case studies, testimonies, screening tools, a video, and the latest research. This continuing education module represents one component of the Geropsychiatric Nursing Initiative to provide online learning in mental health and aging for advanced practice registered nurses and other graduate-prepared nurses and nursing students. This module was made possible through generous support from the Geropsychiatric Nursing Initiative, a partnership of the National Hartford Center of Gerontological Nursing Excellence, the Hartford Institute for Geriatric Nursing, and the American Association of Colleges of Nursing.